Set 10 figures technical question and answers. Answers are highlighted in green. Question 1. A sponsor requests Kaplan-Meier survival curves for an oncology study. What key statistical output should be included in the figure? Option B says only the number of subjects at risk at the start of the study. No. All patients should be included. Option C, a table with raw patient data below the plot. No, we are not interested in raw patient data. Individual subject survival trajectories. No. The correct answer is median survival time with confidence intervals. Question 2. In a phase 3 clinical trial, a forest plot is created for a subgroup analysis of treatment effect. What should be the primary x-axis of the figure? Option A says the p-values for each group comparison. Now p-value is irrelevant answer. The total number of patients per subgroup. That's also an irrelevant answer. The individual patient level response rate. Now this has nothing to do with the forest plot, right? So the correct answer is the hazard ratio or the odds ratio with confidence intervals. Question 3. A clinical trial includes a dose response analysis using a box plot. What is the best way to handle outliers in the figure? Now option A says remove them completely to avoid skewing the results. Now we cannot remove any kind of data in clinical trials as we are dealing with the human patient data. Option C, ignore them since they are not relevant. No, we cannot ignore them. Even if they are outliers, we have to present them in some way or the other. Replace them with the median value of the group. We cannot even do that. So what is the answer is highlight them separately using distinct markers. Question 4. When generating an AE adverse event summary figure, what is the most appropriate visualization method? Option A, scatter plot showing each patient's adverse events. No. We want to present the summary figure, right? So scatter plot is not the right answer. Option C, Kaplan-Meier survival curve. No, we are dealing with the adverse events, right? Not with the events. So here option D says pie chart showing the percentage of subjects in each treatment arm. No. The correct answer is a stacked bar chart showing the proportion of patients experiencing different grades of adverse events, right? So there will be one bar chart. Okay, in that bar chart, the proportion of patients whosoever are experiencing different grades, like say these many patients have got grade 1, then these many patients have got grade 2, then these many patients have got grade 3 of adverse events. So that's how the visualization method will be used. Question 5. A laboratory parameter over time is being visualized using a line plot. What key element should be included to properly interpret trends? Option B, individual patient values without aggregation. No. Only baseline values without follow-up measurements. No. Then option D says randomized patient numbers instead of actual data. No. So the correct answer is mean and standard deviation at each time point, because we are analyzing this laboratory parameter, right? And we are presenting this line plot. Question 6. In an efficacy analysis, a waterfall plot is used to display tumor size change in an oncology trial. What does each bar in the figure typically represent? Option B, the p-value for overall treatment effect. No. Option C, there's a cumulative percentage of tumor reduction across the study. No. D, the average tumor size across all visits. No. So the waterfall plot is used for the percentage change in tumor size for each patient. So typically each bar in the figure represents the percentage change in tumor size for each patient. So your waterfall plot will be like this, right? So as the percentage change decreases, your tumor size also decreases. Question 7. A statistician is generating a spaghetti plot to visualize individual patient response to treatment over time. What is the biggest challenge in interpreting such figures? Option B, lack of individual patient variation. No. Inability to compare different treatment arms. No. The need for a 3D representation. This is an irrelevant option. So the correct answer is difficulty in identifying overall trends due to overlapping lines. So in spaghetti, what happens is there are multiple lines. So it becomes very difficult to identify as to what all the trends are going around. Question 8. A cumulative incidence plot is created for competing risk analysis. What is the key difference between this plot and a Kaplan-Meier survival curve? Option B, it ignores censored observations. No. Option C, it only applies to binary outcomes. No. It does not consider time to event data. No. So the correct answer is accounts for events other than the primary endpoint, then prevent event of interest. Question 9. A clinical study is assessing heart rate changes between treatment arms using a spaghetti plot. What would be the best method to improve clarity in the figure? Option B, display only the baseline and final heart rate values. No, you have to display all the values. Remove all individual patient data and show only the mean. No, even this you cannot remove any kind of data from the figure. Use a pie chart engine. Now this has nothing to do with the heart rate changes, right? So the correct answer is color code the lines by treatment group and add a mean trend line. Question 10. In a regulatory submission, a study team uses a heat map to display patient level biomarker data. What is the most important consideration when designing this figure? Option B, showing all raw values without normalization. No. Using a single color for all values. Now, if you use a single color for all values, it will not try to distinguish. You cannot distinguish the two terminologies, right? The two categories. Option D, excluding patients with missing data to simplify interpretation. Now, you cannot include or exclude such kind of patients who are having missing data, and you cannot even replace, you cannot even ignore such kind of data because we are dealing with human trials data. So the correct answer is proper normalization and scaling of values for meaningful comparison. Please like, share and subscribe. Leave a feedback comment mentioning any topic that you want me to make a video. Looking forward for a positive response. Thanks for watching. Please like, share and subscribe. Leave a feedback comment. Many thanks for your support and having great connection.